Well, a senior staff psychiatrist has been suspended at the Queensland Children's Hospital, accused of transphobia for disagreeing with children's gender transition. Joining me now is health editor for the Australian newspaper, Natasha Robinson. Natasha, thank you so much for your time. Look, what is happening at the Queensland Children's Hospital and why are they so adamant that their gender service is evidence-based?
Well, look, they are following what they see as the standards of care in Australia, which have been devised by a group called AusPath, primarily led by Michelle Telfer at the Melbourne Children's Hospital. These are the guidelines that govern gender affirmative medicine in relation to children in children's hospitals around the country. They're sort of well accepted by most gender doctors, but they are virtually sort of self-appointed guidelines, if you like, because they're not actually sort of official sort of government guidelines or what have you. And this some of the aspects of this affirmative care has been under scrutiny around the world, particularly in the UK, where there's been a major review by a respected paediatrician, Hilary Cass, which led to the closure of the Tavistock Clinic. So that has created a real sort of conversation and quite a lot of scrutiny of the evidence behind this medicine. And there are, quite a sort of sizable proportion of doctors who have real concerns about some aspects of it, particularly in terms of the prescription of puberty blockers. So
just before we run out of time, I want to get to the senior staff psychiatrist, Gillian Spencer. Why was she suspended over allegations that she was transphobic?
So she's been stood down from clinical duties and she's, as I understand it, she's not able to talk about her case, but as I understand it, she's not quite even been made aware of the actual complaint against her. But she is well known within the hospital for questioning the tenets of some aspects of gender affirmative medicine and holding deep concerns in terms of the young age at which children are being put on to puberty blockers and cross-sex hormones. And she also has some concerns around, being sort of virtually forced under her employment to use pronouns, that go against biological sex. And, records are entered into the system that are in conflict with sex, etc.